Good evening, class. My name is Deborah McLeod Baumbach, and I'll be discussing how the American adoption of Chinese medical therapies for pain management has impacted the opioid crisis in the United States. My presentation will be focused on speaking to colleagues within healthcare practice, such as nurse practitioners and nurses. As healthcare providers, we are acutely aware of how the cost of unrelieved pain can result in longer hospital stays, increased rates of rehospitalization, increased outpatient visits, and decreased ability to function fully, which can lead to lost income and insurance coverage. Opioids are currently the first-line treatment for moderate to severe pain management, whereas research has shown that focusing on a multimodal approach to pain rather than just pharmaceutical drug use has been proven to be a better choice. In addition, there's currently an epidemic of opioid use in the United States, and guidelines from the CDC have recommended that the use of opioids for non-malignant chronic pain be used only in certain circumstances. The Institute of Medicine report in 2011 described disparities in pain treatment related to age, gender, ethnicity, and socioeconomic class. Pain was identified as both a national and public health challenge requiring a cultural transformation so we can better prevent, assess, treat, and understand pain of all types. This report recommended assistance with self-management as well as a comprehensive treatment approach that is inclusive of complementary and alternative therapies. Traditional Chinese medicine has focused on restoring harmony through the use of herbals, acupuncture, diet, massage, exercise, tai chi, and meditation, and is thousands of years old. An estimated 59 million Americans currently use some form of non-allopathic medicine. Unfortunately, only about 42% of all adults and about 33% of adults 50 years and older have disclosed the use of their non-allopathic medicine to their healthcare providers. For practitioners of traditional Chinese medicine, there are a number of safe and effective alternatives to dangerous opioid drugs. One advantage, of TCM over, and I will use the term TCM from here on out for traditional Chinese medicine. One advantage of TCM over opioids is that instead of just temporarily blocking pain receptors, you can often get to the underlying etiology and help resolve the problem or give more lasting relief. Acupuncture entails the insertion of needles at specific points along energy pathways called meridians to restore balance, which then encourages healing. It is thought to stimulate the secretion of endorphins, serotonin, and noradrenaline in the central nervous system, while also affecting blood vessels due to the release of vasodilators. Acupuncture may also control pain via the gate control theory, which asserts that a sensory stimulant can be suppressed by another stimulant within the neural system. Acupuncture has been found effective in addressing side effects frequently associated with pain, and successful use of acupuncture for pain management has occurred in a variety of patient populations, including those who have acute and chronic pain, back and neck pain, joint pain, and even labor pain. Additionally, acupuncture has been found effective in addressing side effects frequently associated with pain such as nausea, vomiting, fatigue, decreased quality of life, and anxiety. Mindfulness meditation-based interventions improve pain symptomology across a wide spectrum of pain-related disorders, such as fibromyalgia, migraines, chronic pelvic pain, irritable bowel syndrome, and other conditions. Given that chronic low back pain is the most common clinical pain condition and the leading cause of disability in the United States, it is imperative to better determine if and how mindfulness meditation training can affect chronic low back pain. Converging lines of evidence demonstrate that mindfulness meditation significantly attenuates pain across clinical and experimental settings. In contrast to other health outcomes, the health-promoting effects of meditation are most pronounced for pain and pain-related comorbidities, including opioid addiction and misuse, stress, depression, and anxiety. Some recent studies of fibromyalgia and chronic low back pain patients who received mindfulness training also see a similar decoupling of sensory and affective pain, such that the pain intensity or frequency does not necessarily decrease, but coping with the pain does improve. A systematic review of Tai Chi which is a mind-body exercise therapy, explored evidence of how Tai Chi is used to manage chronic pain conditions. During Tai Chi exercises, the slow motion and weight shifting may improve musculoskeletal strength and joint stability. Concentration and mindfulness meditation, included in the practice of Tai Chi, may modulate multiple aspects of health, including mood, functions of the immune system, and automatic nervous systems. And several trials have documented that Tai Chi demonstrates positive effects on chronic pain. Plenty of evidence presents the effectiveness of TCM as adjunct therapy in the management of chronic pain. If practitioners and culture in America can fully embrace the cultural paradigm shift to utilize the resources available in non-allopathic medicine, such as traditional Chinese medicine, we might actually find a way as a nation to turn the tide on the opioid epidemic. I strongly encourage you as practitioners and as nurses to help educate your patients and your colleagues on the usefulness of alternative therapies and modalities. Thank you.